Hi, thank you for tuning in and watching today. I'm Karen Atkins, Public Information Officer at Kentucky River Foothills Development Council. Kynect is one of 40 programs that we offer to help people in our service region. And today I'm delighted to have our three connectors join me to talk about their program, Pam, Kara Grace, and Doug.
Hello, everyone, and thank you for joining our Get Covered for 2021 event. Today is National Get Covered America Day, and we're here to focus on getting coverage for nearly 175,000 uninsured Kentuckians who are eligible for financial help. I'm Pam Young, a connector with Kentucky River Foothills Development Council. We have a team of 3 connectors, including myself. We serve the residents of Estill, Powell, Madison, Clark, Rockcastle, and Jackson counties in Kentucky. As connectors, we offer free assistance to help you find and enroll in an affordable health insurance plan that is right for you and your family. In normal circumstances, you would see us out at local community events. However, due to the COVID-19 restrictions and the safety of our staff and communities, we are coming to you today virtually. Health insurance is a basic need for each of us, and our current COVID-19 situation has emphasized the importance of quality health coverage. Our goal as a connector is to help you understand your affordable health care options in order for you to make an informed decision when choosing the plan that is right for you and your family. And now I would like for you to meet another co-worker of mine, Kara Grace Kane. She is a connector that serves Madison and Clark counties. She is just wonderful. She's caring and she's there and she's ready to help you anytime. And she's getting ready to tell you about regular Medicaid and a couple of other campaigns that she's working on in the Madison County area. So take it away, Kara Grace.
Hi, I'm Kara Grace Kane, and I'm one of the new Connect members, and I'm covering Madison County and Clark County. So right now I've been working on 2 different campaigns. The first campaign is the College Outreach Program. The College Outreach Program is helping college students get connected with health coverage for free. Madison County is one of the first counties across the state to promote and target this outreach. I have been reaching out with Eastern Kentucky University and Berea College. So far, we are hoping to add more colleges and universities in the future. Another campaign that I've been working on is the 123 campaign. Kentucky just launched this campaign to get more African Americans and Hispanic residents enrolled into health coverage to help make sure that they have the proper care and coverage during the pandemic. With this campaign, Kentucky is hoping to reduce racial disparities in health coverage.
Can someone who is not a traditional age college student still contact you for Medicaid assistance?
Yes, anyone who is in college can connect with us and ask us any questions. You don't have to be at any age. As long as you're enrolled in college, we're willing to help you.
Are there income limits for Medicaid eligibility?
Yes, there are. So the maximum income level for a one-person household is $16,971 a year before taxes. And then for your traditional family of 4, a household, the income limit would be $34,846 a year before taxes. For each additional person in a household, you add $5,958 to that person to figure out what your household would be.
If I already have Medicaid, is there any reason to contact a connector during open enrollment?
Yes, it's always good to connect with your connector during open enrollment. That's a good time just to talk to them and let them know if anything in your life has changed, if your name's changed, you've gotten a divorce, someone has moved out. It's just good to update your profile with them. And things might change with Kentucky Health Benefit Exchange that they want to tell you. So it's always good to just keep in touch with them during that time.
I would like to tell you about another program. It's called the Kentucky Children's Health Insurance Program. And as everyone else, we use acronyms, and I'm terrible at the acronyms. So I'll put this for you. K-CHIP. You might speak with someone over the phone or us, and we might refer to the Kentucky Children's Health Insurance Program as K-CHIP. K-CHIP is a free health insurance for children younger than 19 that are not covered by health insurance. And children's families with incomes less than 218% of the federal poverty level are eligible. Now, I also wanted to give you a little tidbit on the federal poverty level. You will hear when you're talking to Kentucky River Foothills of the 200 or a certain percentage less than the federal poverty level. This is the United States federal poverty level. And that's a poverty level is a measure of income that is used by the United States government to determine who's eligible for various subsidy programs and benefits. And it's reviewed annually. This is a nationwide income guideline. So that's just a little tidbit for you when you are hearing us and different advertise for various programs and subsidies. But of course, we always have that number at our fingertips, so you don't have to remember anything, but just telling you a little bit what it's about. Now, with the K-CHIP coverage for children 19 and younger than 19, it's going to cover doctor's visits, dental care, hospitalization, eyeglasses, vision exams, outpatient services, immunizations. It even helps pay for glasses. And there's just so many more opportunities that, you'll have to get your services that your children might need paid for through the K-CHIP program if you're eligible. And so you can just contact us to determine that. Now, the other program that is not one that's probably might not be familiar to you, but it's called the KIHIP, which is KIHIPP. Okay? The KIHIP is a program, health insurance. It pays for it helps pay for the premium payment as long as one person in the household is eligible for Medicaid. It might help you pay for your employer-sponsored insurance monthly premium payment. Now, this is not what we pay copay when we go to the doctor. This is that monthly amount you pay to obtain the health insurance. To your employer, you pay it, or to your health insurance company. So, and there is help that is possibly available to you, and through the KIHIP, which is the Kentucky Integrated Health Insurance Premium Payment Program. And again, you could call us for more information with this, as everything is going to be, possibly being eligible and pertaining to your situation. And now I would like for you to meet our third and final connector, Doug Justice. Doug has been with Kentucky River Foothills since the beginning of Connect. He is a good friend and a mentor to me, and he is so caring and helpful. So I know anyone, if you've talked to Doug, you can back me up on that. So he is now going to be talking with you about a few topics. The first one that might be of interest to everyone would be the presumptive eligibility Medicaid that is out there now due to the COVID-19 virus that we're all dealing with. And so he's going to talk to you about that and what might be covered with presumptive eligibility. And he's going to talk to you about QHPs. I didn't make me a card for this, but that's the QHP, Qualified Health Plan. He'll be talking to you about those and the APTC, which is Advanced Premium Tax Credit. And for any of you that have obtained a health insurance plan through the federal marketplace and pay your monthly premium, when it comes tax time, your tax preparer you will always discuss the APTC. So I'm sure you've heard of that. And then I know he's also going to tell us about open enrollment. We are currently in open enrollment, but it ends next week. It ends December the 15th. So now I would like for you to meet my good friend, Doug.
What is presumptive eligibility Medicaid and what does it cover?
Okay, basically what presumptive eligibility Medicaid is for emergency situations such as we are in now. What it does, it helps to expedite the process of getting a person or family members on Medicaid. And here in the state of Kentucky, it lasts for 90 days. And there's a fairly simple process in which we go through in order to do that. And I'm not going to get into all the details of that, but the key thing to remember is that it covers you for a period of 90 days. And as the title says, it presumes that you're going to be qualified for Medicaid. And basically what it does, there's certain basic things it does cover. It covers your hospital, pharmacy, emergency room services, physician, dental, lab, and x-rays. And right now, as that 90 days ends, and it can be extended for another 90 days based on circumstances. So that's basically a presumptive eligibility in a nutshell. There's more to it than that, but that's why, and I'm not going to get into that per se. That's why the state has people like myself who the individual can call and ask questions, and we'll can get into the details of that later.
What is open enrollment?
Basically, what we have open enrollment, again, is fairly straightforward. Open enrollment is a period of time whereas an individual can apply for health insurance. They have two ways in which to do that. They can, it depending on income, it's either Medicaid and or they can go to in the state of Kentucky, or they can go to the government website at healthcare.gov and apply for that as well. And it's a way to, for instance, if they already have insurance through the exchange, and these are called exchanges, if they already have insurance through the exchange, they can keep it, what they've already got, which is a fairly simple process to do, or they can shop that as well. And again, that's why I'm here today, is to help them to do that. Now, on the qualified health plans, which we go through healthcare.gov, I am not a licensed insurance agent, so I cannot necessarily tell a person which one to get. However, I can guide, lead, direct, get information to them, let them make an informed decision in order to do that. And they can either go themselves, or I could get on a conference call and with them, go contact the healthcare.gov and do that as well. The same thing as I can up to a certain point with Medicaid. So that's basically open enrollment. As you know, it ends coming up December the 15th. So we've got a fairly short period of time right now. If a person doesn't have it, they certainly need to call in, go to the websites or both or what have you. Again, that's why we're here. That's what I do. That's my job. I've been doing it now for 8 years. And so, and most of the people who are assisters or connectors are fairly well versed in what to do and how to do it.
What is QHP?
That stands for Qualified Health Plan. Again, that's part when we're talking about open enrollment. A QHP basically is a health plan that meets certain basic criteria that is established by the government in order to. There's essential parts of that cover. Hold on just a minute. Let me get to that, and I'll tell you what that is. I want to make sure I tell this correctly. I've got notes here, but I want to make sure I tell you correctly. But it basically covers things like cancer screenings, vaccinations, wellness interventions, STD screenings, pregnancy and blood tests. In addition to that, it also covers basically 10 benefits, which is dependent care, emergency services, hospital, baby care, mental health, prescriptions, disability, lab tests, preventive services, dental and vision as well. And I wanted to read those off directly off the sheet because I think it's important to know. I didn't want to get into necessary detail, but that I did because it's important to know what they do cover. And cannot be discriminated against based on pre-existing conditions. These insurance companies must accept you. And so again, That's why I'm here, is to help an individual to go to be able to get a QHP, and to guide and lead and direct them in a way that best suits their needs to ensure that they get the best coverage possible for the money that they're going to spend, if they spend any on the kids.
What is APTC?
That is basically a tax credit, like going back to the QHP. When you apply for a qualified health plan, you can get, based on household income and the number of people in the household, you may qualify to get tax credits that go against to help you to pay or offset the cost of the premium for that policy. For instance, and this is I'm just using this as an example. This is not in concrete, but I want to use an example or an analogy. Let's say your policy is $400. Well, based on household income and family size, that policy may cost you $200 or may not cost you anything, depending upon the policy that you get in the company and so forth. So it really boils down to APC helps you to offset that. Now, what that is a tax credit. And so the good thing, a rule of thumb to keep in mind, is that every 3 months you need to look, because it's based on income. So throughout the year, if your income goes up, you may get less of a tax credit. If it goes down, you may get more. So a good rule of thumb is every 3 months is to report your income, whether it's changed or not. It's just a good thing to do that. Then that way, when you file your taxes, there's not a lot of necessary confusion that goes along with that. And it's really simple. Again, I'll go back over this because it's important. Number one is that it is a tax credit. So therefore, when you're relating to taxes, credits, and so forth, it's good just to report every quarter how much you've made, whether it's changed one iota or not, because if it has gone up a lot and you don't report that, which I hope people's income does go up, but if it goes up a lot, then you'll get less of a credit. And then you get into issues when you start filing your taxes. So it's just really important to understand exactly what all your income is. Again, I'm going to get into that. They can call us. We can go over what they count as income. But it is a way in which to help the person to offset or pay for their qualified health plan.
Get covered, Kentucky.
Stay healthy and get insured.
Give us a call. We're here to help you, and we appreciate you.